gentle voice. Now we don't have any excuse. What it means is that we want to go when we want for our country. I also want to be by the Honorable Minister. They had not been vaccinated.
As I said earlier on, the vaccination process is taken. Get vaccinated.
We will do mobile where there will be vehicles that may be moving around vaccinating people, or the teams will be moving around. Where we have islands, we will move into those islands, stay there for days just to vaccinate the community, and a combination. But now, because of some of the activities that's going on, we realize that because the virus is there, the zeal to go for the vaccine is low, but people are taking. So we are taking the vaccine to schools, workplaces, churches, mosques, markets, lorry parks, media, and house to houses in some communities. What we are asking for is that organizations, groups, or anybody who want to be vaccinated, once you organize yourself, a team will be brought to you to give you the vaccines, and that will help us to meet the target that we set up. The next slide, which I don't know whether you have, shows that even though when we ramp up our activities, we were able to move from about 20,000 doses a day to nearly 145,000 doses a day. And I think the last 2 days, the number of vaccines delivered has even been higher than it, which means that we have the capability, and we also have the people. If people respond, we can do more vaccine deliveries a day to ensure that we meet our targets. So that's the slide of showing you where you can see how once we ramp up our activities and mobilize the people, people are coming to work. So yes, it looks like the hesitancy is that I want it, but I don't want to go and spend 20 minutes or 1 hour for it. And that's something we all must move away from. So these are the next slides are just pictures on how we have moved to schools, to communities, to villages, among others, to have the vaccination done. For Christmas, we are going to ensure that to prevent importation, the strategies at the airport, which have served us a lot, will continue and be strengthened to ensure that people are tested before they leave, and when they arrive, they are also tested to reduce the importation, and nothing is going to change. We're going to monitor all our ports of entry. We are increasing our surveillance across the country, in all parts of the country, to ensure that any case is followed up. When we have any threat, we're going to look at, we are also going to identify countries of concern, so that if they arrive and they are even positive, the negative, we have a different protocol on how to observe and make sure that they don't later turn positive. Across the globe, that's a major threat for us. Secondly, there's the emergence of the new variant. And I must say that through the robust testing at the Kotoka International Airport, Ghana has detected the Omicron variant already. And the cases have come mainly from Nigeria and South Africa. The very first case that was detected through our sequencing was on the 21st of November. That's the very first time we saw the Omicron in Ghana. The good thing is that when we do all the community tests so far, we've not seen any Omicron within the community of Ghana. But of course, the danger is that if someone has Omicron and is incubating, it will not be found at the airport. And so we still have to be extremely careful, and that's the more reason why we must follow the vaccination, which is key to what. We also have low adherence to protocols across the country. The Christmas festivities are there, family gatherings and parties are in the offerings, and these are all danger signs that we must look at. We also have an anticipated increase in the number of visitors who will be coming to visit us, especially from countries that are already experiencing the surge. One evidence that is here is the fact that last November, before Christmas, we had the whole of November, we had 168 cases at the airport. As at 27th of November, we had recorded 205 cases already at the airport. In the last 2 days, we have recorded almost 30 more cases at the airport. So what's the vaccine update? As has been said by previous speakers, WHO experts, vaccination is still the best intervention for breaking transmission of any infectious disease if you have the vaccine, if you are lucky to have it. The benefits are enormous and provide protection for those vaccinated from infection. It also reduces hospitalization and death from COVID. It reduces disruption of the social and economic activities. Remember, closure of churches, closure of mosques, don't go to the market, people should stay home, work from home. These are all disruptions that is not part of our life. And lastly, it also enhances the mental and psychosocial well-being. There are many people who are just the fear of COVID. There are people who stayed home for 3 months. They didn't want to go out at all because of COVID. These are all mental health issues that you should avoid. Currently, we have 5 vaccines registered in Ghana, and we've had all of them: Moderna, AstraZeneca, Sputnik, Johnson & Johnson, and Pfizer. Apart from Sputnik, we have all these vaccines currently available in Ghana. We have so far received about 12,224 doses of vaccines in the country since the first vaccine arrived in the country. We have distributed 7 million of these vaccines already to the regions and the districts, and about 550 over 5.5 million people have so far been vaccinated. Received over 4 million doses of vaccine, and that is why you tend to see that even though we have received 12 million so far, we've only distributed 7 million, because there are 4 million that came just a week ago. And as we speak, distribution is ongoing to ensure that vaccination of students and the community vaccine, the campaign we are going to launch, their vaccines are available for that. In the pipeline, between now and the end of December, or by the 4th of December, we are expecting additional 10.2 million doses of vaccine to arrive in the country. So that gives us the fact that we're going to have about 16 million plus doses available from now to be able to distribute to our people. That will take us very close to our target. But vaccination, we may probably seem to be doing better than a few of our people, but I can assure you that
so all those who want to go to eat indoor restaurants, you should be vaccinated, and you have a way of checking on your vaccination cards before you're allowed into restaurants to eat. Nightclubs, the same thing. Beaches, will inspect. Christmas, if you want to go around beaches to enjoy yourselves, you need to go with your vaccination cards. And those who want to go and watch football, that we have only 1 or 2 gates, so inspecting these ones will not be very difficult. These are the things that we are introducing at this time, and we'll give a specific date when it will be effective from early January, so that we can have about 3 or 4 weeks to make sure that we have vaccinated ourselves before these mandatory protocols come into force. It is my fervent hope that we will join the fight against COVID-19 by getting ourselves vaccinated. Ghana joined the community of nations to intensify the global effort to stem the COVID-19 pandemic by launching the rollout of vaccines as an additional preventive measure to the already existing protocols: face masks, physical distancing, hand hygiene, including washing of hands with soap and running water, and the use of hand sanitizers. As part of our preparations towards vaccine rollout, I have tasked the National Immunization Technical Advisory Group to issue a policy guide for COVID-19 vaccinations. And on 18 December 2020, same was delivered to guide the ministry on the way forward for the initiation of the vaccination exercise. Based on this guide, vaccination against COVID-19 in Ghana started in phases. The initial phase of the rollout campaign, targeting segmented populations who are at most risk, has been completed. Honorable Chair, ladies and gentlemen, a few weeks ago, the country started the second phase of the vaccination campaign, expanding the rollout to the general population in order to achieve herd immunity and subsequently reduce the burden of the disease in the country. To ensure that the target of vaccinating approximately 20 million people in Ghana is achieved, the government of Ghana, through the COVAX facility, bilateral and other multilateral arrangements, has secured over 12 million doses of COVID-19 vaccines, which are being deployed across the country. Substantial quantities of these vaccines have been received in the last 2 weeks. Additionally, we have over 8 million doses in the pipeline expected before the end of this year. With these enormous quantities of vaccines available, we will have no excuse if we do not move closer to our target. Let me go back to mention that because of our readiness and how serious Ghana was, we're trying to fight and push away COVID from our country. We did our vaccine deployment plan first in the world and submitted to COVAX. On that basis, they sent us the first donation from that bilateral organization that is giving vaccines for free to Ghana. That was February last year. And we started, was it this year? And we started vaccinating in March. We had a very beautiful program. Just at the tail end of March, the source from which they were supplying us these vaccines got blocked. India was hit, massive surge. So they wouldn't allow vaccines to come out from India to Ghana. And that gave us close to about 5 months without vaccine inflow from anywhere in the world to our country. And that is where we had challenges. And our rush to go to procure to make sure that we had continuous vaccination exercise. We want to procure Sputnik, and that gave me massive problems nobody could ever have seen. Our efforts to stem the tide. We are not doubted. That was a challenge. But we said to Ghanaians at that time that let us wait till August and you see what government had done and what our president has done for us. Luckily, all our programs, our efforts to source vaccines have yielded good results, and now we can say confidently that we've got adequate doses of vaccines to vaccinate everybody in our country at the moment. Our efforts at reducing the spread of COVID-19 have yielded great results. However, the end of the pandemic is far from sight. We know vaccines remain the cornerstone for ending the predicament. COVID-19 vaccines are now available, and the best time to get vaccinated is now. It is in light of this that the government of Ghana, through the Ministry of Health and Ghana Health Service, is declaring the month of December as COVID-19 vaccination month. Trained health workers will continue to be available at all health facilities and temporary health posts to administer the COVID-19 vaccine to all persons 15 years and above. In addition, mobile teams will move to towns and villages where they will be located at schools, churches, mosques, bus stops, burials, and market areas to vaccinate people. Let me take this opportunity to ensure the general public that all the vaccines currently being deployed in Ghana, namely Moderna, AstraZeneca, Johnson & Johnson, and Pfizer, have received authorization from the Food and Drugs Authority. These vaccines are safe, effective, free, and offer protection against COVID-19 disease, hospitalization, and death. 3 main things: getting infected, being hospitalized, and eventually, if you're not lucky, dying. These 3 things, the vaccines will protect you against them. So why would you want to sit home without going to get yourself protected? And I'll put it in again. You take the vaccine to protect yourself, your family, other people in your community, the entire community, the nation and everybody even across the borders of Ghana. Distinguished ladies and gentlemen, the significant gains made in controlling COVID-19 so far could not have been possible without our partners. And at this juncture, I wish to thank